Tell me who you are.
Hi, I'm Judy Miller. I'm the Director of Business Development and Technology Innovation at OwlHealth&Care Group.
Cool. So when you look at the ability to have integrated data dashboards, what does it do for the organization? What does it do for you as a leader in the organization?
Well, I think it helps in decision making. We make a lot of assumptions, I think, and inferences when we look at data, and I think having integrated data on a single platform really gives you that picture that you can look at and say, yeah, this is what it means, this is how I understand it, this is how I can use it to make a decision, whether it's to fund a program, expand a program, maybe pivot in a different direction. So data for me takes the guesswork out of what we might do next.
Cool. Can you give me maybe one example of how you use data to make a decision?
Sure. We have a program right now where we've been collecting some metrics around quality of life, and we've been measuring it over every 6 months through assessments, and we've seen what we think is really good outcomes, that we see continued increase in residents' positivity about how they're going to be feeling about their health and well-being in 3 years. So I don't think we could have ever tracked that, or we wouldn't have had the confidence of the data that we do now, that we are seeing these automated assessments and we can see that they are continuing to move forward with this positive outlook. Again, I think it tells us something we wouldn't have known if we hadn't asked and we hadn't automated it in this format.
Okay, so I have to ask, so what is it that you're doing to improve their outlook and programmatically?
Okay. So what we think is by providing a hybrid of virtual and on-site health and wellness programming, we think that can influence outcomes, whether physical, mental, through social engagement. And that's what we're tracking. As we see this moving and this thriving continue over these 3 assessments, we're now trying to track it back to the programs that we're doing. So now we're kind of pushing the data against those outcomes and saying, does it matter they're in this program? We think it does, and this is what this is telling us. We're also now going to have a control group who aren't in the program to see if it looks any different from them. And I think that's going to be really exciting when we see, if we see that we're seeing better outcomes here and not so good outcomes here, that's really going to be powerful for us to continue the program and expand the program.
And without this data, the data dashboard, you wouldn't be able to know.
I like to think that you could have tried to cull it and together yourselves, but no, I would not have the confidence in it. I just have to say that. And the automation that it's allowed and the real time of the data, that's huge. That makes all the difference in the world. As someone had mentioned before, we're not waiting months to see what's happening. We're seeing it on a weekly, if not daily basis, and that's huge.
Cool. Thank you.
You're welcome.